Good afternoon everyone. I am Dr. Prajakta Barapatre, working as a senior lecturer in the Department of Prosthodontics, Crown and Bridge, Mahatma Gandhi Dental College and Hospital. The topic for today's presentation is Role of Saliva in Prosthodontics. This topic will be dealt under following contents: introduction, constituents, functions, importance of saliva in prosthodontics, saliva as a retentive aid, conclusion and references. To start with introduction, saliva is a complex biofluid comprising of electrolytes, glycoproteins and enzymes that lubricates the mucosa, cleanses the mucosa, protects it from trauma, aids in digestion and contributes to the sensation of taste. The daily salivary secretion ranges from 800 milliliters to 1500 milliliters, out of which 60% is produced by the submandibular glands, 30% by the parotid glands, whereas 5% or even less from the sublingual glands, and the remaining 7% from minor salivary glands. Salivary secretion increases during and after food intake, but there is a slow continuous secretion of saliva during the interdigestive period, which keeps the oral cavity moist and well lubricated. This flow varies from 0.2 milliliters per minute from the resting glands to 4.0 milliliters per minute during the maximum secretion phase. The pH of saliva ranges from 6.8 to 7.2. Saliva contains three types of secretions. First, a serous secretion that contains ptyalin. It is an alpha amylase, which is an enzyme for digesting starches. So, the digestion of starch starts taking place from the oral cavity itself. Second is mucus secretion that contains mucin for lubricating and for surface protection purposes. And third is the mixed type of secretion which contains both serous as well as the mucus secretions. The mucus secretion is viscous, whereas serous secretion is watery in consistency. In the completely edentulous patients, the presence of optimal quality and quantity of saliva becomes even more significant. Any alteration in salivary flow or characteristics may have a detrimental effect. Now we can compare the glandular secretions of both the major salivary glands, which are the parotid, the submandibular and buccal glands, and the sublingual glands. As we can see, the secretion from parotid gland is serous, submandibular gland gives a mixed type of secretion, whereas sublingual gland gives a viscous type of secretion. Constituents of saliva are: it consists of inorganic components in the form of ions and organic components in form of organic molecules, and the remaining percentage is consisted by water. The inorganic components include sodium, potassium, chloride, bicarbonates, hydrogen ions, iodides, fluorides, thiocyanates, calcium and phosphates, whereas the organic components includes mucin, agglutinins, lysozymes, lactoferrins, peroxidases, glycoproteins, fibronectins and antibodies. The functions of saliva are many, of which the following are noteworthy. First and foremost is digestion, tissue repair, buffering and lubrication, antimicrobial properties, tooth integrity, water balance, taste and speech. Importance of saliva in prosthodontics. Saliva is classified in three. First is class 1, which consists of normal quantity and quality of saliva. Cohesive and adhesive properties of this type of saliva are most ideal. Class 2 is excessive salivation. It contains more of mucus secretions than serous secretions, and hence these are not very conducive to any prosthodontic treatment. Class 3 consists of xerostomia, which means subclinical salivary secretions, and the remaining saliva, which if secreted is also mucinous in nature. Pre-treatment evaluation before for prosthodontic treatment is all major salivary glands orifices should be examined for patency, and the viscosity of saliva should be determined. During treatment, excessive salivary secretions of mucus from the palatal glands may distort the impression materials in the posterior two-thirds of the palate. And to counteract this problem, the palate may be massaged to empty the glands. The mouth may be irrigated with an astringent mouthwash just before inserting the impression material. The palate may be wiped using a gauze piece, and warm gauze pads may be used to milk the palatal glands of any remaining salivary content. And immediately after that, cool gauze pads may be placed over the gland openings in order to constrict the orifices. In patients with xerostomia, a very careful, gentle approach is essential for patients with dry mouth, as the mucosa and lips are very easily traumatized. The lips should be coated with petroleum jelly to help retraction and to assess the oral cavity. The operator's gloved fingers should be wetted to prevent them from sticking to the soft tissues. And a mirror should be used to facilitate insertion of the tray, as it is less bulky when compared to the gloved fingers. Saliva as a retentive aid. There are two mechanical properties where saliva helps and aids in retention of a complete denture. First, it is adhesion, which means the interaction between two unlike molecules. In this diagram, as we can see, adhesion between the saliva and the tissue, whereas the adhesion between saliva and the denture base is responsible for the correct retention of your denture base. Second is cohesion, which is the forces of attraction between the like molecules, which is between two salivary molecules. So, there are cohesive forces within the saliva. To conclude, saliva plays a very important role in the basic physiology of our body. Its functions are of extreme importance to the specialty of prosthetic dentistry. My references were textbooks of complete denture prosthesis by Zarb and Bolender and Sheldon Winkler. Thank you.